Hi, April.
Hi.
More TikToks today.
You look excited.
Yeah, very excited. All right. Do you have anything to say? How's everyone doing? Hopefully you're doing better than I am. These TikToks. Maybe I'll depress you too.
So we're coming on our tail end of our research through social media to, I don't know. Wow. This, I don't know. So I was all jazzed and ready to do this podcast. Mm-hmm. And then we pull up the TikToks that we haven't seen yet that our virtual assistant found for us. Mm-hmm. And the second that they came up, I just felt heaviness, right? So I don't know. Maybe we just need to all take a deep breath and ground our bodies.
I mean, there's always going to be criticism of the field, right? But it's just it's just the same over and over.
That's it. That's it. It's
from different people.
We're hearing the same thing.
Same thing over and over. It's I don't know. It's hard to hear it over and over again.
That's it. Because I was. That's it. That's exactly right. Because we're very passionate about this project, and we're learning so much from it. You're distracted by your hat, aren't you?
Yeah.
And we've learned so much, and we've been so.
There we go.
Oh goodness. We're on the tail end of our summer break here up in Canada. We've got a week and a half left.
I don't know anymore.
So you're juggling all the things.
That may also be why this is tiring. Maybe if it was during the school year, I wouldn't be so exhausted by this. But this is.
Yeah. But it is like you were saying. It's the here we are again. Because when you first find no matter what project or no matter what you're working on, right, and you're passionate and you're excited and you're interested and you're learning new things, even if they appall you or upset you or whatever, it's you're the adrenaline and the dopamine and all of that's happening. And so at this point though, this is our last reaction, quote unquote reaction video for these TikToks for this particular.
Now, depending on how well these do, we may be forced to do more.
We may be doing more, but I think that's what it is, though. It's okay, we've been hearing these same complaints over and over now, and so, right? I don't know. There's a little bit of everything.
Yeah,
a little bit of summer blues, a little bit of off routine, a little bit of this really stinks. But then what it ultimately comes down to though is that I'm so excited about our projects, and I'm so excited about what we have planned for this fall. That's I don't want to put too much out. I don't want to put too many spoilers out there, but that's aligned with our mission of helping the field and helping other people to provide quality services, and which means taking care of your staff and treating everyone with respect and all of the things, right? So I'm really, really excited. I think now I'm just kind of at the point of the project where I'm okay, let's jump in. I can't wait to jump into the fall where we can really get the word out more and get all of this that we're working on out into the world for you guys to hear, so that we can.
Yeah, our training platform is going well. We have 8 or 9 beta testers. So far so good. I think we've gotten rid of most of the bugs, and we'll be releasing it shortly. And then we have I don't think there's any spoilers. I mean, you can hear. I don't think there's any secrets at this point.
Yeah, there's no secrets. I just don't want to be redundant.
Yeah, and I don't know when this podcast is going to come out. I assume before, but we're going to a conference in October, the CPABA conference. Very excited. Some of the topics that we're talking about are the result of this reaction video research stuff. So we'll be happy to share that with maybe a different audience. I mean, it's still going to be ABA audience, but maybe, people that are newer into the field, and hopefully we can share some of our experience and what to avoid and what good companies really look like, so that perhaps some of this burnout and stress and overwhelm and just this ickiness that we're watching will not be so regular. And so there's that. I think the training platform will help companies take care of a lot of this feedback too, right? Just no support, no training, no way to move up, right? Like those are the big things that we hope this training platform will help provide that gap that seems to be out there.
Yeah, I mean, and to kind of recap, if for some reason we decide to do these out of order and you're watching this one first, who knows, right? But, our project has been, we all know that they're like, I don't know how to say this. I think I need to figure out the phrase of how to say this, but ABA, the ick of ABA and a lot, right? Just in general. But then the fact of why are people feeling that ABA may not be the best route for kids or for individuals for treatment, right? Yeah. And one of the things it kind of boils down to, okay, well, why? Why? And a lot of it is how people are being treated. Yeah. And then that points to techs. Well, hold on a minute. Techs aren't the bad guy here, right? Not necessarily as a whole, right? And so who's responsible, right? So looking at who's responsible within the field as the techs and the BCBAs and, the business owners, and we're all responsible. We all have a part in it. But also, one of the big complaints or concerns that we get from people that we our clients that we consult with, and just from general conversation, right, about ABA is the turnover rate. Turnover rate. We can't find staff, and when we do, they leave, and it's not just techs anymore. The turnover rate for BCBAs is I don't know the numbers, but seems to be just as prominent. And the complaints. So anyway, so we were like, okay, we really want to get some techs. We really want to talk to techs. We want to have a panel for techs. We weren't able to find a panel for techs. We were able to talk to a few random people who wanted to remain anonymous and not, it's like you can't really have a panel with just a few people who you need a group together, right, to have a panel. And so some of the people that we had talked to gave us some really good information and pointed us in the direction of their peer group of where we could find information. And so, or where we could find people. And so we went to those social media places to try to find the people to talk about the things, and still nothing. But what we did find when we were in there were the posts and the comments, and so we really kind of dug in there to learn more. But the overall takeaway from this is communication and how we're just in general how we're treating each other. Wouldn't you say it really boils down to?
Yeah, I think that if you treat your staff well, they'll treat your clients well. And I think that the other thing, that the piece that I feel at this moment after watching all of this is that too many new techs, new behavior analysts are coming into this field, getting a job, and they're like, whoa, I didn't sign up for this, but this is how everybody does it, so I guess I'll do it this way. And where I think coming out of this, my hope is that we can help BAs and BTs that they're just as much of a business leader as the owner of the company, and we all have to hold each other accountable, and we all have to be responsible. I saw a comment in Facebook. I don't remember who said it. It doesn't really matter. But like, we need a union. I disagree. You have an ethic, right? And I think that that needs to be the framework of where you decide, okay, this is unethical. It's not. It's outside of my comfort. I have to stop. And so I hope that we can help. Just regular old BAs and BTs come up with where is my line in the sand, right? And be upfront and transparent, just like we talk to business owners about being upfront and transparent with their staff. The staff needs to be upfront and transparent with the owners of that they work for. Showing, okay, this is I will not cross this line, right? And this is I will not go any further than this,
right? And how to communicate and what to do if your communications aren't there's nothing coming from your communications.
All right,
so let's go ahead.
Enough. So we're gonna start with the first TikTok video, and we'll go from there. All right. So it starts off with ABA Company Edition. Management is employee-oriented and very supportive.
This is a work of art. This is bullshit. This is a work of art. This is bullshit. This is a work of art. But this is bullshit.
All right, so it goes kind of quick, but let's see if we can start it here. So it says, first thing is, management is employee-oriented and very supportive. And they say that is a work of art. And then the next thing is, don't support you when you ask, but punishes you when you make a mistake. That sucks. And as you heard, then the next one that is a work of art balances your needs as an employee as well as the client's needs. And then the BS is makes you work 38 to 40 billable hours a week. Yeah, I mean, especially if you're driving, right? If this is in-home, which I assume it is, but maybe it isn't. And then we have offers. This is, what was it? Beautiful or something like that. Offers ongoing training and paid CEUs. That's great. And then the BS is offers training at a different rate of pay, typically lower. And then that's it. So what do you think? React.
Yeah, I don't know. I think that she's got valid points. I was trying to go back to the
What is it you're trying to go back to?
what she says, the BS ones.
Okay, sure.
It's great.
Is a work of art.
So I mean that's too bad. Doesn't support you when you ask, but punishes you when you make a mistake.
Uh-huh.
I mean that sucks. And then makes you work 38 billable hours a week.
What are the unbillables, right?
Yeah, I mean, because we don't know what the position is here. If it's because especially if it's a BCBA,
that's crazy.
38 to 40 billables, like that means they're working like, I don't know, 70-hour weeks or something. Right. But even a tech, what's outside of the billables?
Yes.
Yeah.
And
then the training rate. I mean, that really stinks. I guess I get like it's hard for me to react to this one because I'm thinking, well, I don't know more. I mean, it's common for training rate to be at a lower rate. It can suck, and especially I don't know how much lower, but especially when you're dealing in like ABA companies with the poor rates that a lot of companies, I'm not saying like, I don't know. I feel it's hard, right? Like I see it both sides. Like it's for the owner, it's really hard to pay for training at the same rate that that you can do billing for. But at the same time, this is the part that was really hard for me as a business owner. It's a really tricky spot to be in, because you do have a specific amount of money to deal with, and I surely wasn't, I wasn't coming out of it a millionaire by any means, right? Like I think my paycheck was like lower than our newest RBT. I don't know. It's hard though, but I could also see the value, like when you're an employee and you're getting paid at different rates for different things, it does like alter the value of it, right? Sure. It's like, oh, so it's important. Is training not as important, or am I not as important when I'm showing up for training as, this whole thing. It's hard.
Yeah, I understand. I guess like I look at some of the companies that we see on Facebook or really mostly it's Facebook, but like they are trying to avoid even paying them for training. So, I mean, it sucks that this is a lower rate. I get that. I can understand that. But, like there's only so much revenue that comes in, and there are certain priorities. I mean, this is how the system is set up. This is where the incentives are, right? There are less incentives to have ongoing support and training because there's no money in that, right? So I can understand both sides of that one. The other points, totally understand, totally on board with. But this one, I mean, it's tough.
Well, and the first one takes me back to like just leadership in general. Like that if you're working in a place where you feel like you're not able to ask questions, but you're getting in trouble if you're making mistakes, that's like a big red flag. Yeah. That like, I don't care what kind of company, whether it's ABA or I don't know, whatever. Yeah. Whatever, like any environment really that you're in where it's like that, then it's time to reevaluate.
All right. So this one starts off with leaving a forced follow-through ABA company and going to a compassionate care ABA company instead. All right.
I knew exactly what to do, but in a much more real sense, I had no idea what to do.
I don't know.
Sure. Moving on. Okay. This one starts off with me and fellow therapists standing on business when our boss... That's right? Standing on business when our boss asks us to do something not in the contract.
Impossible. 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 Impossible.
Okay.
I don't get it. I mean, I get that they're saying that something's really hard, but I don't get what they're saying.
Yeah, maybe outside of the contract.
Yeah.
And they're saying it's impossible. I mean, if that's true, then great. You're standing up for not doing something you shouldn't do.
Yeah.
All right. Next one. I don't know what TW stands for. Do you know what TW? Are we too old for that?
I don't know.
It starts off TW and then : talk of ABA. And now we will listen.
All right, today we're going to be talking about ABA, Applied Behavior Analysis. This is a type of therapy that is primarily used on autistic kids. It is problematic. I will be explaining why. If you don't want to see this, please feel free to scroll. Treatments for autism have become a multi-billion-dollar industry. If you want to learn more about that, I suggest reading this book. I just started it, so I'm not quite ready to book review that yet, but this is a good one. We're going to start with a quote from ASAN, Autistic Self-Advocacy Network. The stated goal of ABA is an autistic child who appears indistinguishable from their peers. What? We don't think that's an acceptable goal. Yeah, me neither. There are shocking ethical and human rights concerns involved with ABA. This is from the 2021 ABA conference. Look at the title of this, Challenging the FDA Ban on Electrical Stimulation. Now, does that sound problematic to you? In 2012, a video went viral of a student having one of these devices used on them screaming for the person to stop because it hurt. This is from the Judge Rottenberg Educational Center. They still use electric shock therapy to this day. This kind of therapy is considered to be a human rights violation by the UN. The FDA had put a ban in effect, but they ended up being able to get it overturned. The FDA ruled that the devices caused a number of significant psychological and physical risks, including the worsening of underlying symptoms, depression, anxiety, post-traumatic stress, pain, burns, and tissue damage. So before I get someone that pipes up and goes, well, that device has never been used on my kid, okay, it's still considered to be standard practice in ABA, so they need to clean house before I'm going to be like, yeah, let's play ball. This is one of the links I posted in my link tree.
Okay, I gotta. It's standard practice in ABA.
Not that I know of.
We work with a lot of ABA practices. I have never seen this done in any way. Now I know, like, I'm not okay with this, right? Like, as far as causing someone pain and punishing them in this way, I'm not okay with that. I think that's a bad idea. Now, I don't know the research behind this. One thing that you know, this is kind of where I get stuck, is we have this person is obviously not on board with ABA, saying we make too much money. And then you have the RBTs and BTs, the RBTs, BTs, BAs saying, hey, I can't get paid, right? The owners of small practices doing the right thing can barely give themselves a salary, right? So, like, yeah, I mean, if in any field, any industry, there's gonna be profit and money made. That's how, this is the system we find ourselves in, right? Like, these people have to get paid so they can feed themselves. I don't know.
Yeah, I don't know. I'm not familiar with the book, and I don't know how much money, like, the industry makes, but a multi-billion-dollar industry to me sounds like way out there. But I don't know. Maybe I live in a bubble.
Well, I think Elon Musk has $250 billion. So a multi-billion-dollar business is not.
And I get that however much money it is isn't the point here. It's the fact that she's saying people are making money off of this terrible therapy.
Yes.
And I mean, this makes me sick to my stomach. And I don't really want to get into the whole, like, electric shock. Like, there's lots of research, and there's lots of, like, within the ABA community that's very divisive, because some people feel that it still has its place for certain cases. Yeah.
Yeah, I'm not down with electroshock therapy. I will go on the record.
I'm not saying that I am. I don't, this is the part of ABA that, and this is, like, part of the problem. I am part of the problem. When it comes to this stuff, I'd rather just put my head in the sand and be like, well, everybody that I know and everyone that we consult with, for what I know, as much as I know, like, everybody does a really good job trying to protect kids and doing well.
Right.
And I'm not a political person, and I'll be the first to, like, turn and walk away from a debate, because that's just not my comfort zone. And even coming out of my comfort zone, doing these, like, reactions, thinking, like, oh, what if I don't say the right thing? But my gut is like, yeah, this is not okay. And this is a lot of people out there feel like this about ABA.
Right.
And that's part of what we're trying to change.
Yes.
In like a small way, by how do you treat your staff, and how do your staff treat the clients that you're working with, the individuals that you're providing services for. And, you know, one of the big pushes that we have was like for supervision, the right amount of supervision and good supervision,
Right.
not just showing up to bill supervision and
Right.
it's not even your case,
Right.
but like good supervision and communication.
Right.
And for a tech to be able to say, yeah, I'm not comfortable with that,
Correct.
you know, and explaining why they're not comfortable.
Yes.
And the leadership of the company being able to say, wow, thank you for bringing that to me. Whether you disagree or agree, like, but having a conversation about it and really looking at what's best for the kid, because there's a lot of abuse going on
Correct.
in ABA, not as extreme as electric shock there, but like just I don't want to, unintentional sounds like I'm making light of it, but some of the abuse may be unintentional. I don't know if that's the right way to say it, but like people are mistreating kids, and whether they mean to or
awful.
don't mean to doesn't matter. They're mistreating kids, but there are things that we can do in our field to improve that, and so.
Yeah. Yeah. I guess, yeah, my thing is, you know, with a lot of this, I guess you can call it anti-ABA movement. What's the alternative? Give me an alternative, right? And I think that's kind of where it gets stuck.
Well, back in the early 90s when I started in the field, like that was what was taught to me, was that ABA is to help make the peers and make these children indistinguishable from their peers. And the idea is to go into kindergarten as not to be like, to not be seen as having autism. Like,
Right.
let's get rid of all of the things that help to make them stand out so that they can fit in with their peers. Now, do I believe that? No. My belief is that we're helping individuals to have a better quality of life and
Yes.
be able to show up in who they are.
Yes.
I mean, I've worked with helping parents over the years who maybe wanted to decrease certain stems or certain behaviors, and I wouldn't help them do that because it wasn't about the kid, it was about them.
Right.
And so that's part of why I started working on like how, like, more of the parent and the parent coaching is, okay, so if your child's, let's say, STEM of whatever sort is bothering you, how can I help you to you know, calm your nervous system or react in a way that, you know, to not be triggered by certain things, like, and same with like tech. So I feel like it should be a very child, or I say child because I worked with children, but a very individual centered kind of therapy. But there's also such a wide range of individuals on the spectrum, and so that's why it should be individualized, because not just one person on the spectrum. You've met one person on the spectrum. Like, it's not, everyone's so different. And that's, I think, what I also value in the ABA that I do and others.
The high quality,
ABA,
ethical ABA.
Yes,
that's out there,
thank you.
yes.
That's what I was trying to say. But that's what we're doing. We're looking to see what's best for the individual that we're providing services for. What are their needs?
Yes.
Where are they? You know, and really helping them. And if they're able to participate in what those goals are, then they can. And if not, then we're working with their caregivers to help come up with what's best for them, to help them to have a quality of life,
Yep.
not to fit in, not to be a certain way, not to get rid of their autism.
Right.
This is a response to a paper that was done attempting to negate the compilation of research presented talking about how ABA was supposedly good. This is the response to that. Conclusion: research in ABA continues to neglect the structure of the autistic brain, the overstimulation of the autistic brain, the trajectory of child development, or the complex nature of human psychology. All of these factors were ignored in the response and are ignored in the ABA practice itself. Providing a treatment that causes pain in exchange for no benefit, even if unknowingly, is tantamount to torture and violates the most basic of any therapy: to do no harm. Autistic folks are out here being taught to suppress their autistic natures to appear to be neurotypical so that their families will feel better about them. That last source is almost exclusively talking about autistic kids who are non-speaking, arguably the ones in our society that need the most protection. If you've had an ABA experience that was good, congratulations, but that's like saying that I was in a tanning bed and I didn't get skin cancer. ABA has been used to harm people, sometimes irreparably. They're going to need to get their house in order before I'm willing to even entertain the idea of saying it's okay.
Yeah, I think the two, like, these two groups need to come together in some meaningful way, right? And I think that there is a group of ABA, pro ABA people that are unwilling to listen to these people, whether it's because it's uncomfortable or because they don't want to hear it, for whatever reason. I do feel like we have to get together, which is why we have talked to, what is it? I know there's two ways to say this. So autistic people or people with autism, whatever label they want to put on it, right? It's not my job to give them, to say it a certain way. How they say it is how I will repeat it back, so we've worked with both, we've talked to people on both sides. And the feedback that I see is that we need to work together. We need person-centered, individualized treatment, and it needs to be centered around, like you said, the quality of life, not you're acting weird, we need to fix that, right? Like, that's not cool. That's not like, they're doing it for a reason, right? Whether it's to comfort or to soothe or whatever it may be. We all have those things. They may not be as visible, right?
Well, yeah, I mean, we could get into the whole masking conversation,
Yeah.
but I agree that there needs to be more communication and working together. And I do agree that I would love for both sides to be able to talk. But I'm going to take responsibility for our side and ABA and say, like, this is why I push for collaboration. We need so much more collaboration between ABA agencies, between BCBAs, between ABA providers, all of us, right? All of us. We need more collaboration. We need to work together, whether that means the person down the street who has another ABA clinic and you're providing ABA in-home, and then somebody on the other side of town's providing hybrid ABA in whatever. All of us ABA people should collaborate and work together. And I really feel like at 3 Pi Squared, at the ABA business leaders groups, the individuals that we work with are really amazing, and they want that too.
Yes.
I haven't talked to anyone yet who has reached out to us for services who say otherwise.
Yes.
But I have worked. Quite a few have reached out saying, how can I be different? How can I make the change? And it starts with you and your town, in your state, but in your town, on your street, in your area, that, reach out to your closest ABA providers and say, hey, let's start reaching out once a month. How can I help you? And coming in with that. And if we're working together and we're helping each other and we're more collaborative, it doesn't mean that we all have to agree on how we're doing things. We can have different ways of doing things that are still within the ethical boundaries, that are still quality services. In fact, it's good that we have different ways of doing things within the science. But we have to work together, and it starts with you and your community. And then, then you guys getting together and going to the state level, because I think all states now, or most states have an ABA, a state organization, a state ABA organization. But you don't have to jump to that. You can do your own thing and then band together, and then eventually, band together at the state level, and we can really make changes that way.
Yeah. And
we can figure out who's, not that we're going to find our enemies, but we can find out, okay, well, what's happening in our town? Are there some practices in our town that are not ethical? How are we doing things? How can we help? And in turn, how can we help these people who maybe aren't providing best services?
Yeah, I mean, yeah, sure.
It's about us and our responsibility.
Of
but
course.
through that, through modeling, through like the more better services that we have out there, and the more that we work together, these other people who aren't providing the greatest of services, like hopefully will kind of, maybe I have a Pollyanna view, but
I would say to push back on that is, how do you know you're not providing good services if you're not listening to the people that are saying?
Yes, that's a really good,
right?
yeah.
And I feel like with a lot of these, pro, anti, ABA groups, they're talking at each other, right? They'll throw, well, this paper says this, and that paper says this, and see, mine is right and yours is wrong, and it gets very political, and no one's really talking together, and so nothing is being resolved. Like, I'm sorry, ABA is not going away. It isn't. It is effective, and if used properly. And that's the same with any other medical treatment. If it is used, if it is abused, like you look at respite care, you look at what is it, oh my goodness, like for elder care, right? Like the amount of abuse that takes. So when people are in a situation where they may not be able to advocate for themselves, and there is money to be made, there will be abuse, right? And so we have to be able to talk to each other, because if we're talking at each other, the point is missed on both sides, right? And so we have to be okay. We have to be okay with accepting criticism and being open to feedback, right? And learning from each other, because this is all this is going to be is, oh, well, my video says this and my video is way better. And so, or my paper is way better because I trust these guys and I don't trust your guys, right? We have to be able to take some criticism that is well deserved, in my opinion, for a lot of ABA. And, like you said, like there are a lot of companies out there that we work with. I hope the vast majority of the companies we work with are, I have not, they don't know what they don't know, and they want to do the right thing by their staff, by their clients. They have left a situation that they have found unethical in the vast majority of these cases, and they're wanting to start something better that is better for the parents. It's better for their clients. It's better for their staff. So hopefully, and like you said, there is still that owners have a very difficult time talking to each other. There is this is my competition, right?
Yeah,
and
there's a very competitive,
and
I'm wrong, you're right, or I'm right, you're wrong kind of thing.
I can't let you have my clients, and that's another thing that really bothers me is when I hear that my client, these are not these are not possessions, these are children that you are working with to help, right? And so I think the framework, that perspective also needs to change. And so hopefully, the collaboration that we've been able to get going has been unbelievable, in my opinion, right? Like, I'll reach out to ABA practices in a certain state, our customers, and within minutes I'll get yeah, of course I'll help, right? So yeah, we need to continue speaking to each other, talking to each other, but also taking this criticism and actually listening to it, understanding that this person is not wrong, right? There is a lot of abuse in ABA and over the years, right? Now, there are a lot of amazing people trying to change this field for the better, right? But then there's also those people that are trying to change it with no data, right? No research, and so we have to be able to work together. We have to be able to take that criticism and then pivot and change for the better, right? And if we're just talking at each other, nothing's going to change. Yeah. So, and special interests are involved. I totally agree with that. Anywhere where there's money to be made, people will try to take advantage of people. And it sucks that, that the people that these well-meaning BCBAs, BTs are trying to work with, they are some of the most vulnerable, right? And which is, again, why it's so important that when you start your job, you have already determined the line in the sand. I will not do this, right? This is as far as I go, right? Beyond this, I am not comfortable and I refuse to do it. And so you have your limits and you let the company know that I will not go any further than this. I will not take on cases where I know we cannot serve the family. I will not take on cases that is outside of my scope and you're not training me on, right? I will not take cases where I know I cannot supervise my staff to the necessary requirements to have effective ethical therapy. I will not go to my sessions when I'm not getting adequately supervised, right? Like these are the things that if we could agree that the ethic is important and not just say, oh, I'm going to report you because you're not following. Like as a community, we have to take what I think the intention of the ethic is to do no harm and provide quality care and come at it from that versus a Bible, thou shalt not do such thing, right? And use it as the tool that it's meant to be used for, right? To provide ethical, quality, high quality care. All right, moving on to the next one. So this one says...
Point of view.
Okay, you
Yeah.
go ahead.
I just figured you were going to... I knew that one. I knew POV was point of view.
Man, you're hip.
I know. I'm so on the coolest 47-year-old out there. All right, point of view. You're asking an ABA company about their thoughts on cultural competency training, cancellation policies, and info about turnover rate, but all you hear is crickets. For those of you watching and can't see, she's spraying like bug spray.
Nonsense.
That's good. I like that one.
Yeah, I mean, yeah. So you're hearing crickets. So keep asking. Those are really, cultural competency is important. So
Yeah.
if you're not working in an ABA agency that provides that, and what?
Yeah, it wasn't just that, right? It's cultural competency, cancellation policies, turnover rates, right? Like so I think like
All those things are very
where do you draw your line, right? What is important to you based on the ethic that you have signed up to follow, right?
And for those business owners out there who don't already have that, these are things that you need to have in place. That's why it's so important to have policies and procedures in place before you hire your first person so that you know what to do about these things. You can change and evolve them over time,
absolutely.
But you have to start somewhere with something. For
has to be a
this, people need to know their expectations.
Yes.
You have to be, 100%. And if your turnover rate is high, there's something somewhere that you can do differently to improve that.
And good on you for whoever did this one. That you have those. You're asking those questions.
Those are great
right?
questions.
Yeah, I
to
think
ask.
those are great questions. All right, this is a long one, so let's get into it.
ABA therapy, applied behavioral analysis. So I'm going to be telling you guys my experience with it growing up. So first things first, everyone experiences ABA therapy differently. I had good moments and I had a lot of bad moments. The people who teach it are not necessarily bad. That's the first thing I always like to say. The people who were there trying to educate me are not the bad ones. They just may not understand what they're teaching is bad. So I found out I was autistic around 13, and for those of you who've been following my journey on social media, we've talked about this a couple times. I started doing ABA therapy around 14, 15 years old, and I had 2 different ABA therapists. And one of them or 2 of them both kind of did this volume thing. They're like, you're at a volume 5, Olivia. And that drove me absolutely bonkers. Who wouldn't it? You're a high schooler and you're being told, like a 4-year-old, that you need to lower your volume like a child. The other half of it is I had a family member would be involved in the meeting, kind of being like, okay, this is what she needs to work on, to the therapist, and the therapist would work on it with me. And it wasn't like, it made me feel like I was wrong or I did something bad. It would have been different if there was different ways to work on it, but ABA therapy isn't like that. Most commonly, the parents are one-on-one working with the therapist, saying, oh, this is what's happening in the household, this is all the things that are wrong with her, even though that's not the parent's perspective. The thing that I wasn't a fan of is trial training. Is, okay, Olivia, if you do this and you work with us on this, later today you and I can have our one-on-one session without your mom. Or if you do this, then you can have this. So basically, it's trial training. If you do what we want, you can get what you want. That also very much goes along with this idea of reinforcement system, which, again, I don't think needs to be involved in that type of therapy. So modeling is also something commonly used in ABA, and it's not like just, okay, I'm going to be quiet and then the other person's quiet. Modeling is literally going to be like, oh, you see that I'm being quiet? Now you need to do the same thing as me. Or you see how I'm shaking a person's hand? Now I want you to shake a person's hand. And I don't think that's the correct way to do it. That's just part one of ABA therapy.
So, I guess my opinion on this, if you're 14 or 15, you should be actively involved in what you're working on in the therapy.
You're supposed to be.
Yeah. You
Like
should be,
like
yes.
I think it's
age
11. I can't remember. It might depend on the state. I'm a little rusty because I focused on early intervention, but I believe it's like 11. Anyways, by that point, for sure, no matter what state you're in, they should have the.
In my opinion, right? Again, it depends on the developmental level, right?
Yeah.
Obviously, but in this person's situation, I would assume I am not a BCBA. I have no business really even talking about this, but I'm going to because it's. Well, why not? Because everyone's allowed their opinion. So I would assume that, this again, right? Like, how are we treating the clients? And if, you as a client are saying, hey, I don't feel comfortable with my parent being in here, which I totally agree with at that age. Like, dude, man, like, I'm fine with doing this, but you need to I want to be able to do this on my own. It makes sense to me, right? And so this that should be something that should be allowed to be requested, I think, in my opinion.
100%.
And so I think that, just like we've already said, but this needs to be individualized for the client and the family, and it needs to be on quality of life, not because you talk too loud. Lots of people talk too loud. What are you going to do, right? Like, I very much consider my wife talks too loud.
Oh,
too.
I talk way too loud. And these types of hearing her, like, I just feel so much sadness and emotion there. It's hard to even respond because this is the part of ABA which left me starting to feel I just don't like to see people feeling like they're not good enough or they're not worthy just the way they are, and using the science of ABA to help people to be able to show up in a way that they want to show up. Now, yes, we might not know, right? Certain kids, like your own your child, let's think about developmentally appropriateness. Like, let's say that you're pretty much on par developmentally, but you're still a 3 or 4 year old. You can't make those decisions for yourself because you have parents. That's why we have parents to make those decisions. Yeah. But it's helping to work with the parent, work together of why? What is your why? What's your intention? And I think that's where things really I was blessed in my ABA career that I worked with some amazing supervisors and amazing, I guess you would say, compassionate ABA providers. Now, some things that I did early in the 90s that were like a lot of trials, a lot of table time, a lot of trials. For some of the kids, I look back and I'm like, some of those kids didn't really quite need that. We could have definitely done a much more of a natural environment, a lot more, play setting and things like that. And so as I learned and I did better, and and that was one of the things I really enjoyed was natural environment training. And I was not the first to bring a kid to a table, right? In early years, yes, but once I started realizing that there are other ways of doing it, and I enjoyed going to work more when I was a tech, right? I enjoyed going to work so much more when I could have fun as well. And we could work together, and when the child wants you to show up at the door. But there definitely is kind of a sadness there for individuals who come out of this feeling like they were broken and needed to be fixed, or because that's one of the first things that I want to look at, right, in those situations is like the intention behind the parents. Like it is hard for me just to make a blanket statement, because I can file, like I'm like thinking about all the different cases over the years that I worked with and like how different so many of them were. But ultimately, when it came down to it, we can use the science in a way that we can show up for people compassionately. We can help guide them. We can help guide their families with the intention behind like improving their quality of life. Maybe, and this individual, I don't know your story, but, and I get it. If somebody was constantly telling me, oh, you're at 5, like, even when you're like, honey, you're being loud, or when we're at a restaurant growing up and my brother would be like, April, shh, 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 shh. Like, what? Because I'm just a loud person. That's just who I am. So the more you're going to tell me to hush, 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 like the more, that's going to frustrate me and upset me. And I'm less likely to do, but there might be certain occasions that maybe socially, like if you don't understand in certain settings, you do need to have a more quiet voice. Like, so there's a place and time for these things, but it's all in like the intention behind it. And I don't know. I feel a little, I'm just not quite sure the right wording to use, because there's a lot of emotion behind that when I hear that someone feels that they need to be fixed or they're broken, and that's some of my own baggage I bring to the table. So
I think we both have that kind of like, oh man, I'm broken going on, right? And so like the mindfulness has been something that has been very effective in my life, right? Where accepting, okay, here, this is the environment I find myself in. Now, how do I want to move forward, right? How do I want to be in this world, right? And so this like it's not so much about fixing as it is, this is where I'm at, this is where I want to move forward, and so how do I go on that path, right? Knowing that this path is going to be full of bumps and curves, and I'm going to fall down, and that's okay. But knowing that, like you said, the intention here is I want to do this thing, right?
And the intention, and if a parent's intention is that, oh, I want my child to be indistinguishable from their peers, or like anything that like seems like perfection, right? That's when then I want to start having more conversations with the parents. And that's one of the reasons why, as I was shutting down my ABA company, that was my mission moving forward, was how can I support parents through this. And I'm finding myself instead still very much in the ABA field, helping providers and techs and BCBAs and those business leaders to be able to help them to use some of those strategies within their company. But I guess it just boils back down to collaboration, honestly. So if we're working together, because a lot of small business owners that we work with are solo BCBAs. Mm-hmm. and they feel like they don't have anyone else to turn to. We hear that
Correct.
a lot. We hear that so much. And even if maybe you're a BCBA owner and you have BCBAs under, you've hired BCBAs part of your staff, like you still feel like you're in a different level. And so then I don't know how the BCBAs who work with you feel, if they feel like they're able to collaborate and communicate together, or if they can communicate with you. And then, like I said earlier, with the BCBAs and in your town, right? And I get we have to be careful about HIPAA and like all of that. I mean, absolutely yes, but there are ways to talk about these topics without exposing who people you're talking about. So if we could have more conversation, then maybe we could like question each other.
Yeah.
And ask, oh, that's interesting. Like, we had this behavior. This was the function. This was the plan I put in place. The data is like squirrely. So then we, whatever. And then be like, so what do you think about that? And then asking questions like, so what was the intention behind that? And asking like developmentally appropriateness questions, asking like social validity questions, like things like that, that piece I feel like could be missing in a lot of scenarios where maybe it's not that we've already discussed the abuse things but maybe we could help to make ABA just a little bit better, even when we're helping with like that social validity and looking at the intention behind the behavior and making sure that we're like working on this thing for the right reason.
So I think just, going back to, accepting, great, you accept where you're at, but to say that now my painting is finished, right, when I'm 15 or 20 or 30 or 80, right, would be the wrong way to go, right? Like, so to say, okay, this is my lot in life now, I must accept it and just be here, right? And that's not what it is. It's here's where I'm at. Again, here's where I want to be. And why do I want to be here? Because I want to, and then moving forward with a plan. And then the other thing that I'll say on this one specifically is, going back to that collaboration. Maybe this BCBA or this team has no business working with a 15, 14-year-old. A lot of BCBAs work with, most of the time, early childhood, and then they're like, oh man, I feel like I can help this person, I guess, but I don't really know. I guess I can try it. And then you are not doing what you should be doing because you don't understand that age or what would be appropriate in that scenario, and asking for that feedback, right? And putting those things in place where it is more focused on the individual and less on the family, whereas a 2-year-old is going to be more focused on the family and less on the individual, just because 2-year-old can't say, hey, I don't like this. This isn't my kind of thing. I want to do something different, right? So, but we would still tailor it to that 2-year-old. If that 2-year-old loves playing with a specific thing, we want to bring that in, I think. But again, I am not an ABA therapist. I have no idea what I'm talking about here. But I would say that, maybe in this situation, if there was more collaboration, that BCBA could say, hey, I know you're working with, a lot of teenagers. What would you do in this situation? Or should I just, say, hey, this person has a great group that they're working with. They do this all the time. Why don't you check them out and see if they can help, right? Like, so I think if there was that more open collaboration and understanding, again, with that boundary level of we're not accepting anyone past this age or this developmental level because this is outside of our scope. This is as far as we go, right? Unless we bring in some outside training and, right? And
and it works the same the other way. If you have an individual who's only worked with adults and then you're hiring them for a child position, I'm not saying don't hire them, but I'm saying offer them the training and collaboration opportunities that they need to be able to learn the skills. It's just, I don't feel like it's any different than, like, let's say there's a feeding issue, and so we reach out to an OT or speech therapist, or if there was a mobility issue and we reach out to a PT, or like we should be reaching out to all these, but sometimes I feel like the collaboration only comes in play when it's like an extreme situation. But we can read the research, we can there's a lot that we can do, but I would love to see a lot more collaborating on these things. And then also if you don't have the skill set,
Yeah.
don't just put this kid on your wait list.
Right.
Don't do the assessment and put the kid on your wait list and just keep them hanging because it's dollar signs or whatever.
Well, yeah.
I mean, and I'm talking to the extreme,
Sure,
like
sure.
the people who
there-
probably aren't even listening to this podcast.
Yeah, probably
like,
not. But there are those other people that are like, oh man, I just want to help. Okay, maybe
There
I can try.
are.
And
Yes.
maybe you shouldn't try, right? Like
maybe
it's a-
your trying is helping them to find someone else that can serve them.
Yes.
Or if you do, like being very transparent and making sure that you're seeking out, and that's where the 1099 BCBA would come in, right? Like then you contract with someone. Hey, I'd like to learn. Here's a situation I'd like to learn. Please help me. Let's work together on this case.
Yeah, and I think incorporating, again, that system in place where are we doing what the family and the client needs and being able to capture that in a way, right? What is our intention and why are we doing this, right? And so having in this case with someone that can advocate for themselves in a very meaningful way, allowing them that opportunity to advocate for themselves, not waiting for them to say, I don't like this, I don't want to do this, and this is why, right? Giving them that opportunity, I think,
Well, and I think that's where Ascent comes in. There's a lot of mix. There's a lot of mix on Ascent, and what that looks like, and we're working on that, on finding some people to talk about that as well, because it's gonna, it's like we go by, human nature, right? We go black and white, and we're like, oh, Ascent. Well, how is a 2-year-old? What, you were just gonna let him run across the street because he wants to, like.
Right.
No. But then you have this, young adult, this teenager, young adult who is advocating for themselves. Heck yeah, in my opinion, and we all have our own opinions, but advocating for what you need and what you want in life is so important.
Yeah.
So I would be reinforcing the heck out of that, right?
Yeah.
And now, of course, there are some things that still young adults and teens, even grown-ups, even old people, elderly people, whatever. There's still laws and regulations we have to follow to be part of society. So I'm talking like all the things in between. It doesn't have to be
Extremes.
black or white, so extreme for everything. And I think that is when we have these strong feelings, that's where things tend to get pushed.
Sure. Yeah. Yeah. I mean, it's easier to pick apart the extremes, right?
Yeah.
So,
It's because it's a lot more concrete, right?
yes,
And there's
in the middle is where it's very nuanced.
The ego is like very strong there.
Yeah.
Do we have any more? Or was that the last one?
That's it. That's it for now. So
collaborate with each other. Support your people.
Yeah, and collaborate with us. So, like, if we got something wrong in this, I want to know.
Oh, please.
Right? So, like, tell us what we need to know and how we can do better. We just want to try and get as much information out here so that business owners can see what is going on. It's very important. So, if we miss the mark, we want to know. This is our take and our opinion, but I want to be doing the best possible job that I can for myself, my family, and the community that we work with. So
what's our intention?
What is our intention for these reaction videos? To give them the voice that I assume they want.
By them, you mean ABA
So,
peoples out there, text.
yeah,
BAs.
these people are literally screaming on the internet saying, hey, this is wrong. It shouldn't be this way. And hopefully, by us allowing their voice on our our podcast, business owners will hear this and maybe a less aggressive way, I guess. Maybe that may provide some impact, or maybe it'll kind of squeak in the side, right? Where they may be able to hear it a little bit easier.
Like, oh, I wasn't expecting that, but then it's like
then,
train wreck, so they have to keep listening.
Yeah, and so then maybe they can take that information and say, oh wow, there is this situation in my company where I can make this better. So that I guess is my intention, is to allow us to be the sounding board so that we can then take this information that we have learned from it. Again, this is our perspective, and maybe we're missing the mark on this. But again, leave us a comment and say, "Hey, dude, you got this one wrong." But my hope is that we can then transmit this in a way that the owners can hear it and use these effective strategies that we'll get into in later podcasts about how to change that culture in the company to support your techs and support your BAs. And then the last thing I'll say, after doing 4 of these freaking videos, I have a new perspective, which is that the BAs and the BTs have to come in to the company with an ethic that they will not cross, and they have to know it. It has to be concrete in their mind. They need to write it down somewhere. I don't know where, but this has to be, hey, this is the intention. I will not cross these lines, and it needs to be very transparent, in my opinion, so that you know that you're doing the right thing, right? That's kind of where I'm coming at it at this point. You?
Yeah, my intention is to help change. I want and to be able to help change how things are.
Yeah.
Have to be uncomfortable. My people pleaser self is like, oh, what if I said something that offended somebody? You know, if I did, let me know. Come talk to me about it.
Yeah.
So I'd like to model that collaboration and communication. And so these are hard things. We're not gonna change it in a day. We're not gonna change it at one podcast, but we can start talking about it, or we can talk about it. And I'd like to see some action too. And I think that's what I love. Stephen's stance of, okay, well, if you're not getting what you need, you know what you need. If you're not getting what you need, what action are you going to take?
Yeah.
Anyways, I don't know. We could ramble on about this all day. It's quite a passion project of ours at this time because it's so important, and we hear so many people out there, and we just really want to help. And that's our thing, is how can we help? And so, you know, this is how we're trying to help.
Yeah, I mean, I guess the last thing I'll say on this is that, like, some people may get offended, and while that is not my intention, and again, leave a comment, email us, whatever. The only reason people are getting offended is because this is a very passionate topic, and people just want what's best, right? And so if this was easy, it would have been solved already, right? And so this is a difficult, there's a lot of moving parts, there's a lot of nuance involved, and so there's not one size fits all, and so this very subjective, right? And some of this, there is going to be no data. It's on, you know, like in a lot of ways, this, because it's so individualized, it can be very difficult. So there is going to be a lot of passion, and it may cause some offense. But like, in order to make meaningful change, I don't see how you can have a conversation about these issues without offending someone. So, you know, I apologize for any offense that I may cause. But in order to move forward, what else can we do? So
I mean, passion seems to be the word of the day.
No.
I mean, and that's why I am so passionate about the, like, having your, like, knowing your values and really building your company on with values in mind. And because, you know, and I, like, in turn, like, there's a lot of back and forth and working together with intentions and values, right? And so I guess my call to action today, on a smaller scale, that everyone, I think, can do and start doing right now, would be just start practicing asking yourself, what's my intention in that? For whatever you're pouring your coffee, what's my intention in that? Just starting to be aware of it, and so that when you're in your business day-to-day workings and doing the things, what's my intention? Or I wonder what their intention is. So I'm going to ask them what their intention is, especially like if, like, supervisor, what's the intention behind this program? I'm just curious, right? So just really using your curiosity and asking questions, and also to yourself about your intentions. And if you don't already know own values, or whether you're a business leader or you're someone else out there in the community, that will come into play and also help you to be that anchor, because they kind of go hand in hand.
Yeah,
with-
I think
with
ultimately at the end of the
intentions.
day, the value is your ethic, right?
Right.
So like those kind of are hand in hand,
Yeah.
right? I think that, I think that's it. So,
right.
hopefully this is helpful. It's not surprising, but it's still a little shocking, right? Like, I don't know. It was difficult to go through hours of this, right? So, hopefully it's helpful and you can take something away from this that can improve the field. And if
Reach out.
anyone, please reach out. And if there's a different side to this that we are not seeing, I've got lots of blind spots. You can point all of them out to me because I'd appreciate that, to be honest. If you want to come on and tell me how full of crap I am, I'm open to that conversation. And
We can have a private conversation,
or we can do it on a podcast. I'm totally fine. I'm sure I have embarrassed the hell out of myself unknowingly on this podcast more than once. So, come on, talk to us. Because if you have those feelings, many people have those feelings, and it's important. So, have a wonderful day, and we'll see you next time.
See you next time.